Alarming disparity. Why is the U.S. struggling most to lower chronic disease deaths among wealthy nations? It's a scenario that might surprise or even worry many. Of all high-income Western countries, the United States has made the least progress in reducing the chances of dying from chronic illnesses. This striking revelation comes from a groundbreaking study recently published in The Lancet, raising urgent questions about America's long-term health prospects. The researchers, led by a team at Imperial College London, analyzed data from 185 nations and territories, focusing on deaths linked to chronic, non-communicable diseases like cancer, heart disease, and stroke. Their analysis spanned from 2010 to 2019, a pivotal decade. What they found was both hopeful and concerning. While in most countries, the risk of dying from these illnesses by age 80 decreased, the pace of improvement slowed compared to previous years. But here's where it gets controversial. In the U.S., the pattern looked much worse than in other wealthy countries. In the United States, overall deaths from chronic diseases did decline for most age groups. However, among adults aged 20 to 45, deaths actually rose, an extremely rare occurrence in Western high-income countries. This unusual trend stands out starkly when compared with peer nations such as Denmark, which led with the most substantial reduction in chronic disease deaths. The U.S., on the other hand, lagged at the bottom of the 25 high-income countries studied, with Germany only marginally outperforming. America isn't alone in its struggle, but its position at the rear is striking, said senior author Majid Ezzati. He noted that while other nations, including Germany, also saw slow progress, the U.S. was the clear laggard. Bit of a surprise, right? What's even more intriguing is the pattern behind the numbers. In many developed countries, deaths from chronic diseases dropped only moderately, partly because an increase in conditions like dementia offset declines in other diseases. For instance, as advances were made in cancer and heart disease management, neuropsychiatric illnesses such as dementia became more prevalent, muddying overall progress. The researchers dug into various age groups: young adults, 20 to 45, working age adults, 45 to 65, and seniors, 65 to 80, using data from the World Health Organization's Global Health Estimates. Between 2010 and 2019, about 80% of the countries studied, which together represent more than 70% of the global population, saw chronic disease deaths fall. These widespread improvements were attributed to advances in diagnosis, earlier detection, especially for cancers, and better treatments and medications, supported by evolving clinical guidelines. But here's the part most people overlook. In around 60% of countries, and especially the U.S., the rate of improvement slowed compared to the previous decade, or previous gains even reversed. Ezzati observed that countries performing particularly well did so for both seniors and the working-age population, while laggards struggled across age groups. In the U.S., barely any reduction in mortality among older adults, combined with stagnation among working-age adults and rising deaths among younger adults, paint a serious picture. So why is the U.S. lagging? The study itself stops short of dissecting specific causes, but Ezzati points to several likely culprits. One glaring issue: disparities in public health investment leave some groups with far less access to preventive and primary care. In concrete terms, millions of Americans live far from hospitals or trauma care, and primary care shortages can mean delayed diagnosis or management of chronic issues. Another worrisome twist, unique to the U.S. among wealthy nations, is a rise in deaths linked to conditions like dementia and alcohol use disorders. While improvements continue for cancer and cardiovascular disease, these neuropsychiatric conditions have intensified, weighing down national progress. This publication emerged hot on the heels of the Trump administration's Make America Healthy Again Commission, unveiling an action plan aimed specifically at curbing childhood chronic diseases, a move mirroring the country's urgent search for solutions. U.S. Health and Human Services Secretary Robert F. Kennedy Jr. has highlighted that more than 3/4 of U.S. adults already live with at least one chronic disease. Elena Lattis, a Columbia University professor and global expert on chronic diseases in youth, voiced cautious optimism. She praised the focus on minimizing ultra-processed foods and reducing exposure to environmental toxins in new U.S. policy initiatives. Yet she stressed the need for an actionable path toward genuinely shifting American lifestyle and wellness habits. Everyone's talking about the right issues, she pointed out, but the real question is, how will these strategies be enforced in the real world? Lattis, who has researched health systems in more than 20 countries, recommends that the U.S. take a broader view of wellness. Better nutrition must be made affordable, unlike in Europe, where local markets are often cheaper than grocery stores. American farmers' markets can be prohibitively expensive. And it's not just about diet. Lattis urges the embrace of holistic approaches like meditation and deep breathing for mental health. We can't rely solely on medication. A broader, more integrated approach to wellness is necessary. And this is where the debate gets heated. Will the U.S. truly be able to reverse its troubling trajectory? Or are further setbacks looming? Are systemic inequalities and healthcare access barriers too deeply entrenched to overcome? And who should be responsible for fixing them? Do you agree that prioritizing wellness and preventative care is the way forward? Or do you think structural reforms are needed at a deeper level? Jump into the comments. Let us know where you stand, and if you see hope on the horizon for America's fight against chronic disease.